Thank you. Good afternoon, new state ombudsmen and mentors. Welcome and thank you for joining us for today's webinar, Systems Advocacy 101. This is Amity Overall-Lade, Director of the National Ombudsman Resource Center, and this webinar is part of our orientation training for new state ombudsmen. During the presentations, all lines will be muted, and we'll open the lines after the presentations for Q&A and discussion. If you have any questions during the presentations or have any issues with your audio or anything like that, you can send us a chat message and we will respond via chat or ask your question during the open Q&A time in the agenda. Also, as you may have heard just a moment ago, this webinar is being recorded and it will be available on our website along with all the resources mentioned during today's training in the near future. The goal of today's webinar is to provide an introduction to systems advocacy. We will define systems advocacy, discuss the role of the Ombudsman program in systems advocacy, review some resources, give some how-to tips, and hear from your peers. Following my slides, Joe Rodrigues, California State Ombudsman, and the chair of the NASOP Advocacy Committee will discuss the role of the Advocacy Committee, and Teresa Holt, the State Ombudsman from Alaska, will share her experiences with systems advocacy. Then we will have time for Q&A and open discussion. In the 1995 Institute of Medicine report, otherwise known as the IOM report, Real People, Real Problems, an evaluation of the Ombudsman programs of the Older Americans Act, sums up the responsibility of the Ombudsman program to engage in systems advocacy when it says, in addition to working on individual cases and complaints, Ombudsmen must address and attempt to rectify the broader or underlying causes of problems for residents of long-term care facilities. When working on these systems level, Ombudsmen advocate for policy change by evaluating laws and regulations, providing education to the public and facility staff, disseminating program data, and promoting the development of citizens organizations and resident and family councils. So what exactly is systems advocacy? Advocacy simply means the act of pleading for, supporting, or recommending. A system is a combination of things or parts forming a complex or unitary whole or a coordinated body of methods or scheme or plan of procedure. And systems advocacy, therefore, is to recommend changes to a system that can benefit long-term care residents, specifically for Ombudsman programs. For example, it could be changes within a long-term care facility because that's an entire unit, a government agency, an organization, a corporation, so one corporation that owns a chain of facilities, policies, regulations, or law. The Older Americans Act, the AOA, the OAA outlines the responsibilities of the state and their long-term care ombudsman programs, clearly stating that the primary role of the long-term care ombudsman is to serve as resident advocates. Ombudsmen are charged with serving as the resident advocate in response to individual complaints, as well as advocating for the concerns of residents and need for change on the systems level. Systems advocacy is a core responsibility of the Office of the State Long-Term Care Ombudsman, as the Older Americans Act requires states to establish and operate its office in order to, 1, represent interests of residents before government agencies, 2, seek administrative, legal, or other remedies, 3, analyze, comment on, and recommend changes in laws and regulations that pertain to the health, safety, welfare, and rights of residents, and last, facilitate public comment on laws, regulations, policies, and actions. The Older Americans Act requirements regarding systems advocacy apply to the Ombudsman program and the program's representatives, meaning state and local ombudsmen are expected to engage in systems advocacy. However, the role of the state ombudsman in regards to systems advocacy varies from the role of local ombudsman or program representatives. For example, the state ombudsman may create a statewide systems advocacy plan and typically represents the office of the program in testifying before the legislature. As the head of the office, the state ombudsman has a responsibility to set the tone and messaging as it relates to systemic advocacy in order to maintain program consistency and coordination in advocacy work for all program representatives. Although the roles and approach of state and local ombudsmen in systems advocacy differ, the requirement to voice resident concerns at the systems level is the same, whether in individual facilities, a corporation, locally, or statewide. The final rule expands on the intent of the Older Americans Act and gives more detail regarding the role of the ombudsman, including the role and responsibilities related to systems advocacy. So I'll briefly touch on some key points in the rule today. In addition to the language of the final rule, AOA's responses to comments on the rule that were published and the first round of frequently asked questions give even more insight to the role of the ombudsman. Reviewing those may be helpful to you when you're responding to questions about the role and duties of the program, or if you just want better understanding of certain aspects of the rule. So if you look under 132711E5, some key points regarding systems advocacy include that state policy and procedures must assure that the office is required and has sufficient authority to carry out its statutory responsibilities as the office determines is appropriate, meaning the state ombudsman, and regardless of state lobbying laws. The AOA response to a comment acknowledges that systems advocacy has been a challenge in some states, especially when an ombudsman, the state ombudsman, is a state employee. Further, it clarifies that consultation with the state agency, State Unit on Aging, is encouraged, but that cannot be used to control the positions or communications of the office. This section of the rule clarifies the functions that the ombudsman shall, either personally or through representatives of the office, do. It reiterates functions from the Older Americans Act, including systems advocacy, and provides further clarification that the ombudsman's fulfillment of systems advocacy function of the Older Americans Act does not violate federal lobbying restrictions and positions of the office. And the positions of the office do not necessarily represent those of the state agency or other agency where it's housed. Also, the ombudsman is responsible for providing leadership for the statewide systems advocacy efforts of the office. In AOA's response to a comment about this particular section, they provided an example of ombudsman advocacy related to a resident receiving an involuntary discharge notice, and it provides a great example of how ombudsmen represent the interests of individual residents as well as making recommendations for changes to the system related to a specific issue. In addition to the program requirements regarding systems advocacy outlined in the Older Americans Act and Rule, the Administration on Aging has responded to questions regarding the Office's systems advocacy's responsibilities. This is just one example of a statement by AOA in a letter from Jim Bartness, the Regional Administrator for Region 5 of AOA, to John McCauley, the Director of the Iowa State Unit on Aging, regarding State Ombudsman testimony. We have additional examples on the NORC website. As I stated earlier, the role of the State Ombudsman varies from program representatives in regards to systems advocacy, and here are some of the most important aspects of the role of the State Ombudsman in systems advocacy. The State Ombudsman needs to develop a plan or agenda, and in doing so needs to involve representatives in systems advocacy, whether it's looking at data, identifying casework, asking them to communicate cases or concerns directly with government representatives or the legislature. The State Ombudsman needs to provide leadership and model systems advocacy, for example, provide testimony and also show them other ways that they can get engaged. And of course, State Ombudsman need to provide support. You need to provide training to representatives regarding issues and systems advocacy and drawing that connection between what they do day to day and what they can do systemically. The State Ombudsman also needs to provide support and assistance to address any barriers that their program representatives may encounter in trying to conduct systems advocacy, whether it's speaking with the media, writing letters, providing testimony, or anything of that nature. They need to provide support and advocacy for their program representatives. Here are some quick tips. We have a few of them throughout the presentation, but these were some resources that we wanted to identify for you to review, and we'll include links on the website whenever we post the recording from today's webinar. There's a NASOP white paper, which I believe Joe will talk about as well, and a position statement. The NORC curriculum for State Ombudsman and self-study guide discusses systems advocacy. The Bader report, which I also believe Joe will reference. And there is a NORC quick reference guide that we produced a couple years ago talking about the role and responsibilities of ombudsmen regarding systems advocacy. It's a brief, and there's also a state version, State Ombudsman version, and a local ombudsman version. So the State Ombudsman yourself and your state staff could use that brief not only to educate others about the role of the Ombudsman program, but also your program representative. So in the next few slides, I'll explain how you can do that and just give you an overview of that resource. Some other resources you may be interested in helping you explain the role of the Ombudsman program in systems advocacy, of course, would be the primer developed by NASOP as a project. It's a primer for state unit directors and their executive staff to explain the role of the Ombudsman program. There's a systems advocacy points of reference, and we'll have a link to that as well. And of course, the NORC curriculum, again, the history and role in particular in that module. Here's a snapshot of what that quick reference guide looks like, as well as the link to it on this slide. And again, we'll provide the link to all these resources on the website once we post this. The quick reference guide regarding the role and responsibilities of the program to engage in systems advocacy provides an overview of systems advocacy, the Older Americans Act requirements, AOA statements regarding this responsibility, and then it also addresses and defines 4 systems advocacy strategies. Those strategies are mentioned on this slide, and it provides examples of ombudsman advocacy for each strategy, a chart with basic questions that ombudsmen need to consider when engaging in systems advocacy, and last but not least, a list of systems advocacy resources. As I said earlier, there's a state and a local version of this brief. The examples and the questions in the chart are different in each version based on the role and responsibilities of state and local ombudsmen. We really hope that you would use these guides as part of your orientation training with new ombudsmen, or perhaps as a refresher for experienced ombudsmen, as well as initial continuing education training for both staff and volunteers. These guides, as I mentioned, could be used to inform others outside of your program about your role in systems advocacy. We thought it was important to illustrate several systems advocacy strategies in this guide because legislative advocacy tends to be the advocacy approach that comes to mind when thinking of systems advocacy, but it's not the only one. It's an excellent example, certainly, but there are other ways for state and local ombudsmen to voice resident concerns and address issues that impact residents at the systems level. So the ones that are mentioned in the guides are a procedural strategy, one that strengthens ombudsman policies, procedures, and program tools related to systems advocacy, providing information and training regarding the ombudsman role in systems advocacy, and pursuing meaningful, regular communication and coordination with other entities related to systemic issues in long-term care. Another strategy would be coalition building and partnerships, just meaning that you'd expand the reach of the Ombudsman program by developing partnerships, building or joining a coalition with other entities that share an interest in improving long-term care. And of course, another systems advocacy strategy would be issue advocacy, in which you would develop a systems advocacy approach in response to a specific issue that's identified after you analyze your data, or perhaps it's a timely hot topic. Maybe there was recent press attention in the media about a specific issue. Then that would be an opportunity for the Ombudsman program to really provide some public education about that issue, shine some light on something that maybe people aren't aware of, and push it further and really develop a systems advocacy plan around that issue. And of course, there's legislative advocacy, where you analyze, comment on, and monitor the development and implementation of either federal, state, and local laws, regulations, and policies related to long-term care. As I said in the brief, we do share some examples of all four of those strategies. Here's some examples on this slide. Just to keep things simple, I just highlighted some state ombudsman examples, but those in the brief obviously are both state and local examples. And then you'll find throughout the NORC website, we're highlighting systems advocacy examples, whether it's on an issue page or a program management page. Systems advocacy examples are scattered throughout the website, hopefully to help illustrate what state and local programs are doing in regards to a specific issue or challenge that they're facing. So some examples are on this slide, but for issue advocacy, the Connecticut Ombudsman Program sponsored and is a partner of the statewide coalition of presidents of resident councils, and they host an annual Voices Forum. Due to a question during a Voices Forum in 2005, they created a statewide work group, then commissioned a study on the fear of retaliation in nursing homes. And from that study and that initial question in that forum came out a wonderful training video based on that study's finding about residents' fear of retaliation. And there's a training guide, and that video is available on our website now. So that's just one example of an issue that came up based on dialogue with residents and how they took it and ran with it and developed an entire education system around that, not just for residents, obviously, to empower them, but also for facility staff and advocates. So that's just one example. This slide shares some of the questions that can be found in the basic questions to consider when engaging in systems advocacy chart that's in the quick reference guides. The chart has questions divided among four main categories for consideration. So what you need to do in the preparation stage, how you need to identify resources, what resources you need to consult and look for, things to consider for program management, and things to consider when you're addressing potential barriers. So some examples are in preparation. You need to think about how you're including program representatives in this effort. How will you share your plan with them and systems advocacy activities in order to keep them engaged and involved and draw from their experience in the field every day? For resources, do you have any internal program resources that could be utilized, whether it's staff or volunteers whose skills or expertise may be related to that particular issue? In regards to program management, is there additional training necessary for individuals that are going to be involved in this process? Are you providing leadership and support for your local ombudsman and understanding and making an impact on this process, system, or issue? And of course, potential barriers. You need to consider if there's any opposition to your systems advocacy agenda, And if so, you need to craft some responses to their concerns so you're ready whenever they ask questions and you get that pushback. So that's all part, and that's just a snapshot of what's available in that chart to really get you thinking and planning whenever you're developing your systems advocacy approaches and agenda. In addition to all those resources, we wanted to provide you with some how-to tips for systems advocacy. So we are including this advocacy planning cycle. It's from the Water Supply and Sanitation Collaborative Council website. And as you can see, the link is on this slide, so you can visit their website later to get some more details. I'm not going to review every point of the cycle, but their website has a very detailed review of this cycle, and you can click through each step that you see on the cycle for more detailed information, advocacy tips, and it directs you to other pages among their website. So it's an excellent process for you to walk through whenever you're looking at developing a systems advocacy plan. For example, they have an advocacy will checklist. They have steps on how to create a problem tree and how to develop a problem analysis framework, as well as an advocacy and campaigning toolkit. So some really good tools and examples for advocates. To give you one example on this cycle, you'll see that step 1 is to identify and analyze, which simply means to identify your issue and analyze the facts, data, and stories to fully understand the problem. Step 2, set your objectives. That seems pretty self-explanatory, but their website provides a process to follow in order to really define your objectives. It's called SMART. And S in SMART stands for specific. What exactly do you want to happen? M stands for measurable. Will you know when you've achieved them? A is for achievable. Is it possible to achieve them, your goals, given your resources and time, which I think is a very important question for all ombudsmen, both state and local ombudsmen to consider. R is for relevant. Are your goals relevant and appropriate to all stakeholders and to the problem itself? And T is for time-bound. By when do you want them to happen? So a very clear process to really identify, and that's just talking about setting your objectives. And then if you visit that website, you can click through to every single step on the cycle to get some more concrete examples to walk you through your advocacy plan process. So some final quick tips to keep in mind when developing your systems advocacy agenda or plans. Make it easy for others to get involved. That sounds really simple, but I think you really need to drill down and think about what everybody has on their plate, not just you, but everyone that you're going to make requests of. Consider what's on their plate in order to make things as easy as possible for them to get involved, engaged, and really understand the issue, and make it a package deal, really, for them to just take it and run with it. Create a sense of purpose. In order to draw people together and to develop some energy behind your systems advocacy, you really need to create a sense of purpose, which I think with the Ombudsman program and your program representatives, that sense of purpose is already there. They're already very dedicated to the quality of life and care of individuals. However, you may need to create a sense of purpose around a particular issue or approach in order to get people motivated to act. Define clear and specific goals, and then prioritize those goals. And if possible, start with a goal with the greatest potential for success, because as I'm sure you understand, if you succeed once, then more people want to get involved the second time around and be behind you and in the other areas that you want to pursue if you've had a little taste of success. So I think that's really, really critical. So I know I covered a lot in a little bit of time, but as I said before, all these slides and materials will be available after today's webinar. And now I'm going to move on to Joe and his slides. So Joe, if you want to unmute your line. Thank you. Go ahead.
Sure. Good afternoon, everyone. I wanted to talk to you this afternoon a little bit about NASOP's Advocacy Committee and what we do, and perhaps how you can get involved in the work of the committee. Next slide, please. So the Advocacy Committee is one of 3 standing committees that we have in NASOP. If you were at our fall meeting in Washington, you may remember that historically we've had several ad hoc committees that have done the work of the association. The beta retreat, going back to 2002, identified several committees that would do the work of NASOP on behalf of the association. And over the years, those ad hoc committees have had some overlap. So last fall, we decided that the NASOP, the committee formerly known as the NASOP Systems Advocacy Committee, an ad hoc committee, would rename itself the NASOP Advocacy Committee. That's the name that we have in our bylaws. The Federal Policy Committee, which was established as an ad hoc committee several years ago, chaired by the existing or current past president of the association, would look at federal proposed rules, policies, legislation, and on behalf of the association, prepare and submit comments to the relevant federal organizations that have oversight for those policies and rules. We also had another ad hoc committee, the NASOP Appropriations Committee, that dealt primarily with requests for appropriations for ombudsman work in the Older Americans Act. At our fall meeting in November, we decided to merge those three ad hoc committees and to have them work under the aegis of the NASOP Advocacy Committee as a standing committee. The bylaws define our role and say that the Advocacy Committee shall study and address issues relating to long-term care. This includes, but isn't limited to, promoting the advancement of the ombudsman profession, creating and implementing ombudsman programs, and establishing a positive impact on the lives and needs of long-term care residents. The Advocacy Committee shall be a self-acting committee who works in conjunction with the membership on various issues relating to long-term care. So we felt that those activities of the Systems Advocacy Committee, the Appropriations Committee, and the Federal Policy Committee all fell neatly within this definition that we have in our bylaws. Next slide, please. So what exactly does this committee do? Well, as I said, we review and comment federal legislation. We were quite involved in developing amendments that committee staff took on the reauthorization to the Older Americans Act. If you look at the bill that the House just approved, many of the provisions in that bill came directly from NASOP, and we're very pleased to see they were included in not only the Senate but the House version of the reauthorization bill. We also review and comment on proposed policies and rules. We commented extensively on the proposed rule for ombudsman programs. We most recently commented extensively on the proposed conditions of participation for nursing homes to participate in Medicare and Medicaid. That went on over several weeks, actually several months of time as we poured through those proposed rules and thought about the impact these rules would have on residents. In the past, we've developed white papers on selected issues. For example, Systems Advocacy and the Long-Term Care Ombudsman Program, the white paper that Amity highlighted earlier, was a product of this committee. We knew that back at the time of the creation of this paper, we knew that several state ombudsmen throughout the country were having problems engaging in systems advocacy because of rules that their host agency or their state had in place. We conducted, with the help of Sarah Hunt, a very thorough one-on-one interview with the ombudsman, state ombudsman in all 53 programs to ascertain their ability to engage in systems advocacy. We knew that some of those interviews couldn't be conducted during the day at someone's office because of fear of retaliation. Some of those interviews had to be conducted in the evening at the State Ombudsman's home. Those kinds of issues were highlighted in the white paper, which we presented to Kathy Greenlee at AOA shortly after she became the Assistant Secretary. And it's, I think, because of this white paper that identified the problems that State Ombudsman have, that we got on Secretary Greenlee's radar, and the proposed rule, or rather the final rule that we have today for the Ombudsman program, which so eloquently reinforces the requirements that are in law now in regulation. I think we're really there because of the work of this committee and the light that we cast upon the problem of engaging in systems advocacy that so many state ombudsmen had at the time. We also advocate, again, for NASOP's appropriations requests with Congress. We provide testimony, we provide letters, we try and make contact during Hill visits with appropriators and their staff to advocate for the resources that we need to operate this program and serve residents. Again, you know, with the reauthorization that the House just approved, we see very modest increases for our program, certainly well below what we've been asking for, but you know, I think we're one of the few programs identified in the reauthorization bill that actually got an increase. So again, because of the advocacy of individual members of the committee and their relationships with legislators and appropriators, we have that increase in the bill. And certainly, again, when we're in Washington or when our legislators are home, we try and visit and meet with them and their legislative staff on advocacy issues like the reauthorization of the Older Americans Act. I can tell you there have been many visits made to Senator Sanders' staff and many phone calls that we had with them as the original reauthorization bill went through the Senate, and having the ability to speak candidly and freely with them and suggest to them things that would really help us do our job was invaluable in getting these provisions into the Act. Next slide, please. So what are we doing right now? Well, as Amity referenced earlier, AOA released a first set of frequently asked questions on the Ombudsman rule. These were questions that either individual state ombudsman raised or the Advocacy Committee raised or Federal Policy Committee raised to AOA ACL. We just about 2 weeks ago sent another request for clarification on several other provisions in the Ombudsman rule that we feel still need to be clarified. We were involved in advocacy on getting the House to pass an Older Americans Act reauthorization bill, so we were successful there. We have been engaging in advocacy on increasing the appropriations for the Ombudsman program, again with some limited success there as well. And we monitor the Federal Register for proposed rules that we may want to comment upon. One opportunity to provide comment just became available to us this past week, and it's on the National Adult Maltreatment Reporting System, otherwise known as NAMERS. NAMERS is the new elder abuse reporting system that AOA ACL is developing for adult protective services. And there was a notice last week in the Federal Register seeking comment on the reporting system itself. So that may be an opportunity for us to weigh in on that reporting system based, or I guess in the context of our own work in elder abuse and reporting and the type of data that we collect in NORS. Next slide, please. Many of the resources that that have been mentioned in this call are available both on the NORC website and the NASOP website. The NASOP website, to be quite candid, needs some updating. We need to post some letters and other testimony that we've provided Congress, but you'll also see their position papers, white papers, and comments that we've previously submitted to the feds on our website. Not many people use the website, but it is a good resource and has some good historical information on some of these issues that we've been working on for quite a while now. Next slide, please. And that would conclude my portion of this. One final plug, if you are interested in participating in the Advocacy Committee, we do meet on a monthly basis on the third Wednesday of each month at 3:30 Eastern. We try and keep our meetings to about an hour. Sometimes, depending on the breadth and scope of the document that we're reviewing, we might meet more frequently. So depending on the need, at least once a month, sometimes more than that, but generally once a month. And during those meetings, we discuss obviously any proposed rules or policies that the feds have, any work that we need to do on reauthorization and appropriations for the program. So I would encourage you to join us. Again, if you're interested, please just send me an email and I'll add you to our distribution list. We know that all of you are very busy and sometimes it's difficult to make these on a consistent basis. But we would appreciate any participation from you as your schedule allows. And with that, I'll turn it over to Teresa.
Thank you, Joe. All right, just 1 second, everyone. I'm going to go ahead and change presenters. All right, Teresa, you're up if you want to go ahead and open up your presentation. And let me make sure that you're unmuted. Just 1 second. All right, there you go. Let me see.
Okay, you can hear me now?
Sure can. Thank you.
So my part, I think, is going to be, I have an echo. Can you hear the echo?
No, I can't.
Okay. I'll brave on then.
If anyone else, if you'll just chat me, that would be nice. Thank you.
So my portion, I think, is more specific about legislative advocacy, but this kind of plan works if you're trying to change a policy, you're trying to change the way the system works. But because legislative advocacy is the most scary to most people, I did the example based on legislative advocacy. And in the realm of that, I just wanted to clarify that there's a spectrum of educating all the way to lobbying, and I really try to stick on the end of educating legislators so that there is no confusion about whether we're lobbying. And you can do this whole plan and stick on that educate end of the spectrum, and it causes a lot less hassle, even though technically we probably could be on the lobbying end. I really try to stick to the education end. And I also want to give credit to the Midwest Academy. If you've never heard of that, that's where the framework for what I'm going to share with you comes from. I've modified it sort of to fit my needs and changed some of the ideas, but the basic framework comes from them. And if you ever have the opportunity to attend a Midwest Academy training, I think it's 4 or 5 days. It's fairly costly, but it is really awesome. So I want to start with, you really need to be specific about what it is you're trying to change. Oh, and I wanted to say, if you haven't seen it already, about halfway down the sidebar for GoToWebinar, there is a handout. It says Handouts 1, and then under it there's a blue W in or a white W in a blue box, and that's where the systems advocacy strategy plan that I'm going to the specific plan about a specific issue that I'm going to be referencing. And after a while, I'm going to switch over to that plan. But if you want to download it, then you can sort of see what I'm talking about as I go through it. I don't think you have to download it. I think you can just open it. So really, I think one of the first things that I learned was that you have to be very specific about what you're after. And this can be, so the example that we're working on in our state right now, and the example that's in the handout, is changing the power of attorney statutes in our state. And so we sat down, a group of folks sat down, and we realized that in our state you have to cross out the things you don't want on that power of attorney form, and it just seems counterintuitive. And so we wanted to change that so that people could initial the things they actually wanted, because what we often see is nothing's crossed out and the senior signs everything. The other thing that we wanted to see was some specification in the power of attorney statute that allows criminal prosecution for people who abuse that statute. So this all sort of comes under what will change when the goal is implemented. Those are the things that we really wanted to see change. So we wanted to see seniors, instead of just signing a form and not really understanding it, having to initial each power that they're giving away and to understand it. And then we wanted for prosecution of abuse where, you know, whoever is using the power of attorney goes to Vegas on the senior's money. And so those are really the things that we wanted to see change. And also in this part, as you're looking at these specific things, sometimes if you can develop a tagline is just a short sentence that sort of sums up what you're going to do or what you want people to know. A famous one is the Nike, just do it. Or it could be something as simple as stop elder abuse. But, you know, anything that you can do that gets it short, because a lot of this work you're going to have short pieces that you can share in the elevator is a good example. Let's see. I'm going to go to the next slide. I've never done this before, so you have to bear with me. I find it really important is to gather a team of people, so other folks who are interested in making the same change as you. And that can be all kinds of people. It doesn't necessarily just have to be ombudsman. In this particular case, we gathered together the Ombudsman's Office, AARP, Council on Aging, Adult Protective Services staff, and then we have local senior advisory boards that are usually around senior centers. And then the Care Coordinators Association was really interested in this, and those are people who help develop plans for folks. I don't know if everybody has the same name in every state, but they were seeing examples of this, and it was the clients that they were working with, so they were very invested. And so we brought together a group of people for the meeting, and these are going to be our partners. These are going to be the folks who are actually going to do the work to make the change. And so as part of that, we asked them to list what they might bring to this project. For example, Long-Term Care Ombudsman Office was going to organize all the meetings, start collecting data, and collect examples of where things have gone wrong. AARP was going to use their mailing list potentially, because they have a list of all the seniors in the state. So if we wanted to do a public education campaign, they could mail it out to everyone. And they would donate the postage as part of their job. They also have an advocate who works in the capital city and goes up on the Hill quite often, and so they would donate that. Council on Aging, you know, so we went through each person. What are you going to bring? And then you want to make sure you think about, out of the people in the room, are there other partners who are really willing to do the work to make the change needed? And should we add some of those folks to the group? So you might think, you know, care coordinators or even assisted living home association might be someone else you might want to bring in if they're really invested in part of this issue. And then at the very end, be sure you figure out who's going to do what. And the most important piece is who's going to facilitate the plan and who's going to set up the meetings. Everybody's super busy and everybody's volunteering their time essentially for this project, for these projects usually. And so you want to make sure that someone has said, okay, I'm going to do that, and they actually have the time and the ability to do that. Next is figuring out who will support your initiative, whatever it is that you're doing a change. So for changing power of attorney laws, you know, obviously seniors, the prosecutors who are prosecuting elder fraud, we're interested, and that's very obvious. But try to think of groups outside your normal community, such as for this particular situation, assisted living homeowners were interested mostly because they wanted to make sure they got paid. And in situations where the power of attorney was spending the money, sometimes they weren't getting paid. Other people who use power of attorney would be another group outside the normal community. So parents who use power of attorney when they leave the state or leave their child in care of somebody else, they might be very interested in this. Banks might be interested in power of attorney because they have to accept them or reject them, and they also have an investment in senior fraud, in preventing senior fraud. Homeless shelters, sometimes folks end up homeless after someone's spent all their money. Food banks, you know, are there people outside the group? So these are the folks that we pulled in who might be interested to support our initiative. And generally, they are not going to be the worker bees. The partners are the folks you started with. But these are people who might be able to support, give testimony, show that this is a broader issue. And if you can't really think of some folks outside your normal community, go back to that original slide where you were thinking of the outcomes that you want to see. What is it that you want to see, and who would be affected by that change? You can also look to see what groups might have influence over the policymakers. So for example, there might be a bank that is very politically, you know, the owner of the, or the manager of the bank, or the owner of the bank might be politically inclined and have friends in the legislature. Those different kinds of things that you might be able to see. One example of one that I worked on was we were trying to expand transportation systems. And so those groups outside of our normal community of seniors and folks with low income, seniors and people with disabilities, we looked to folks with low income who use the bus system. We looked to people who were interested in sort of an eco-friendly system. And so those were way outside of our normal group that we would work with. And then I think it's super important to look at who will be against your initiative. And it can be a person or a group, but it can also be an idea. So you want to look at who might be opponents. So in our particular case, the opponents were, there was some attorneys who were very faithful to the Uniform Law Acts. And so there is a power of attorney, uniform power of attorney law. And so we were changing one of the pieces to that, and that was the idea that people would need to initial the powers they wanted to give away. That was sort of surprising for us. That sort of came out of left field. And so that would be a group that we would want to identify ahead of time if possible. You know, people might come out and speak out of it if they're power of attorneys and they don't want anyone messing with their powers. Scammers, banks and financial institutions were the other group because they have issues of when they accept and when they don't accept, and our bill had some changes to that system. And so what you want to do is find out why they're opposing your issue and know ahead of it. Look at that and reframe the issue and have answers to what their argument is, and always look for a way to make it a win-win for both sides. And also just be a public opinion. So when we were doing the one on public transportation, our biggest idea against it was that it's going to raise taxes. So you want to be careful with that. And then look to see how you can counter the opposition. So be prepared to answer their questions, but also look to see who might have connections with them, and who might know about them, who might have a personal story or have power over the folks who are going to be against your initiative. And then probably the most important piece is to know who has the power. And so once you've specifically defined what it is that you want to change, you need to know who has the power, who's going to be able to make a difference. And usually we talk about primary targets and secondary targets, and it's not a bad thing to be a target. It's really just a focus on that particular person. So who has the power? Well, for our example, it is the members of the legislature, because we're going to have to get a bill passed. And specifically the members on the committees who are in power and on the committees where the bill will have to pass through. So, you know, if it has to go through finance, who's the chair of the finance committee? And then we need support from our department that this is an issue for them, because generally they are called to testify. And so what we went through and realized is that our governor has a sister who lives in an assisted living home, who has a power of attorney. So that might be a place to start. You can look for other legislators who might have elderly parents, legislators themselves who are over 60. We noted that our State Unit on Aging director had an elderly mother in another state and was having some issues with her care, and so he was very sympathetic to our scenario. And then develop an action plan. And this is very, very important, and leads to some of the things that Amity was talking about. Specific steps. Who's going to oversee the plan and call the partners together to make sure you're making movement on your plan. And I think that's really the most important piece, because you can come up, you can spend a couple days or a day developing this great plan, but if nobody's following the plan and following up to make sure you're working on it, then you're going to not be successful. And then you want to have different strategies. So you want to be able to educate your partners, the people, and your supporters. You want to be able to educate the identified targets. Look at strategies for education to the public. And one of the more important things that I have found in my successful advocacy efforts is to have a visual symbol of your initiative. So in one scenario, we were talking about getting more services for folks with disabilities, and so our tagline was give them the key to open the door to opportunity. And so we had everyone who was helping us tape a key to a postcard and send it to their legislator, and then one legislator collected all the keys and he would bring them to the general sessions or everywhere he went for a meeting about this and say, this is how many people have care about this issue, and that really had a great effect. Another idea was we were working on getting additional funding for infant learning programs, and so we had the programs ask their family members if they would send their legislator a photo of their child that was in the program with a little note about support this. That was highly effective. We showed up at the legislature and people had them up on their walls. And then the one most recently that we were successful for was we were trying to get a change in our state regarding insurance plans paying for services for children who had autism. And the tagline was, it costs less than a gumball per day. And so they went around the legislature and they gave everybody gumball machines linked to the chairs of committees and gumballs that they put on everybody's desk, and it like got picked up by the news, and it was really effective because it showed how inexpensive this scenario was. So what I'd like to do now is I'm going to have to get out of here, and I want to show you the plan so that we can go more specifically through the examples at the end of implementing the plan. So here we go. So I'm going to scroll down here to the action plan. So the first step for us in our plan was to identify a legislator or a governor to sponsor a bill. And we talked among the group, and people did research, and we talked about whether to use the governor because he had a sister in assisted living, or whether there was another legislator who was very powerful. We talked about whether the governor and the legislature are getting along, because that makes a difference who you want to sponsor your bill. Looking for legislators who are attorneys, and whether they would be for or against the bill was important, and really targeting legislators who are over the age of 60 was very useful. Then we decided to do a similar thing, but look at folks who might co-sponsor a bill. So once a bill goes through, you want to gather as many co-sponsors as possible. And again, we look for powerful legislators and trying to get large numbers, and really looked at the same types of issues. The next step is what I call defining or developing a white paper, which is sort of a written document. You have to keep it to one sheet, hopefully one-sided, but if you can't get it on one side, you can do double-sided. And we use this white paper for a lot of things, but it's really for the partners to come together and gel specifically what are we talking about and why are we asking for this change. We always try to include some stories and some actual data about how many people are affected by this issue. And then we try to pull out a 60-second sound bite so that if we have to do like a TV interview or a radio interview, or we're in the elevator with somebody, how do we get our issue across in 60 seconds? And then really that's where that tagline and that visual representation come into play. If you can, like I love the gumball one because it was a visual that people could see, but it really gave the message it costs less than a gumball to implement, and that was so successful. Then we developed from that white paper, which can be handed to legislators, it can be emailed to people to get them interested in the idea, but then we develop actual talking points. Ideally, each partner and each person who would testify would take these talking points and they would make it's really a framework for people to have a discussion about the issue, and we make it in almost like a worksheet. So we have the idea, number one talking point, and then we leave space for them to fill in their own story or their own details or data to share with folks. The next step is to educate the public about the issue. Our focus was on seniors and family members, long-term care providers, public attorney, prosecutors. And we listed what each group was going to do. The long-term care ombudsman would look to do assisted living home and nursing home and hospital presentations. AARP was going to send out our white paper, which we had all agreed on, and host a statewide teleconference presentation on the issue. Council on Aging would bring that to their members and to their legislative committee. Local senior advisory boards were going to go ahead and hold a presentation during the senior lunch at their senior centers and hand out those white papers. Care coordinators were going to use the white papers to talk to their clients, especially any who had a power of attorney, and see if they were having issues. Then we developed, once your bill is introduced, then we developed a plan to look at specifically what legislators are on which committees where the bill is going through, and how do we get individuals, constituents who live in those districts to call their particular legislators and share their stories. And I think it's important here to let people know that, or actually on the next, I'll go on the next one. So then we developed a plan to testify at the hearings, because each committee would have a hearing, and trying to get seniors, family members, care coordinators, different people who might be able to testify, being sure that the the State Unit on Aging staff understood what our talking points were and why we were using them. Sometimes they'll actually take our talking points and use them because they're so well developed. And at this point, working with the folks who you think are going to testify, and you want to get them ahead of time so that you have time to sit down with them and go over the talking points. Make sure they sort of write out their ideas, even if it's an outline form. What you don't want is somebody who rants and raves and goes on to a different issue and gets lost. And so that framework of the talking points is really useful. And then have them practice. And make sure that they can keep it to 3 to 5 minutes, because that's usually all they're going to get. They need to be able to tell their story, and you don't want them to get halfway through and not be able to tell their story. And so I found that to be very useful. People are a little hesitant to practice, but getting them to do that really will help you in the end. The next thing is being sure that you're prepared for the media, because more often than not, media take a look at specific bills and they're going to either call you or one of your trusted partners. In our particular group, AARP had a public relations staff, and so we decided that we would direct all the media to them. But again, we had our talking points, so if it came to us, we had our talking points and our 60-second soundbite. And you can also be proactive and make plans. If you have trusted reporters or reporters who've done things for you before that you know will run a story and that won't bite you in the butt, then you can go ahead and do that. And social media is the one I know the least about, but again, we tagged the AARP public relations staff because they were social media savvy. Social media can go either way, so you have to be super careful about how you do that, because if you have detractors or people who are against your policy, they can get on and send people to whatever Facebook page or website or social media that you're using and post really negative things, and sometimes it can blow up in your face. So this was really quick and fast to go through this whole process. It takes weeks and weeks to go through all the steps. And really, I have to say that starting with that specific goal and knowing what your projected outcomes are going to be is really helpful, because you can always go back to that and say, okay, does this talking point really get at the issue that we're looking at? So I hope that was helpful. And if you have any questions, you can certainly call me. I've done systems advocacy in Alaska for quite a while, and I would be happy to brainstorm ideas with you. Thanks, Amity.
Thank you, Teresa. Just 1 second, let me switch back the controls. That was a fantastic presentation. Excellent tips about the primary targets and how to identify those, and the secondary targets and the visual symbols. Just great. So thank you for walking us through your process, and thank you, Joe, for sharing that information about the NASOP Advocacy Committee. We have already received one question for that, and I asked them to touch base with you offline for more details, so that's great. So now is the time for our open question answer for our presenters today. And just as a reminder, you may have heard in the introduction of today's webinar, this webinar is specifically for new state ombudsmen. It's part of the orientation training that we provide new state ombudsmen from NORC. So I'll be taking questions from state ombudsmen, both new state ombudsmen as well as the experienced ombudsmen that we have on the line that are the mentors. But I will be fielding those first from new state ombudsmen since it's their call. So I see some chat messages, so if you'll give me one moment, let me open it up and see what we have.
So, Amity, I forgot to read my favorite quote.
Go for it.
So, never doubt that a small group of thoughtful, concerned citizens can change the world. Indeed, it's the only thing that ever has. So, you can do it.
Absolutely. You're exactly right, Teresa. Thank you for sharing that, and that's one of my favorites as well, and it's definitely kept me going in those hard times when you feel like you're not making any progress, so thank you. So any questions? Do we have any questions from the new State Ombudsman on the line? If you do, you can raise your hand and we'll call on you, or you can send the question through the chat feature. And it could be any question to Joe, Teresa, or myself, or about what they talked about today, or any challenge as a new State Ombudsman that you're experiencing whenever you're looking at, say, your program data and trying to identify trends and figure out a systems advocacy approach or strategy, or any other barriers or successes. So anything you want to share. And Joe, I received your message. Thanks for letting me know about that you may have to head off the call earlier than you thought. So if you have, I don't have any questions in the queue right now. So if you have anything else you want to say, maybe follow up on anything.
Yeah, I was just going to say, sometimes I think, people may feel somewhat inhibited or uncomfortable talking about any restrictions they may have on participating in systems advocacy. And if you're uncomfortable and want to talk to someone privately about this, please feel free to pick up the phone and give me a call or shoot me an email, and I can talk to you about some strategies that we've used over the years to get through that and to help educate your boss or bosses about your responsibilities as the State Ombudsman. And there's a way of doing it, I think, that can be helpful in helping your state unit director feel that you're not a troublemaker, you're not making an end run around them, but rather you're simply trying to do the job that's outlined for you in federal law and regulation. So if people are uncomfortable discussing those challenges, I'm happy to talk to people offline as well.
Thank you so much, Joe, for saying that. And I second what Joe shared, and I'm sure that any new State Ombudsman, when you get in a group with other people, you'll be surprised at the similarities and the challenges that you may have and the barriers that you encounter. And so it's a great group to rely on. And if you contact us at NORC, we also have, we can either put you in touch with specific people or give you examples of how State Ombudsmen have handled those barriers and challenges in the past. And some of the resources that I mentioned earlier in my presentation speak directly to some of those challenges as well. So thank you very much, Joe. I appreciate that.
Sure.
So I'm not seeing any questions come through, so pretty quiet bunch today. And so I'm going to go ahead, and I know that we all have a lot on our plate, so I'm sure a little extra time is never a bad thing. So I'm going to go ahead and roll into to the end of the presentation today. And if you did have questions that you either didn't feel comfortable asking in front of the group, then let us know offline and I can respond, or I'll put you in touch with the right people. Or anything comes up later that you're thinking about systems advocacy, let us know. So in closing, as I stated when we opened the webinar, this is just an introduction to systems advocacy. There's a ton of materials on our website, and as you can tell from Joe and Teresa's presentations, a wealth of knowledge from your peers. And so take advantage of that. Thanks again to Joe and Teresa for sharing your knowledge and firsthand experience with systems advocacy, and thank you all for joining us today. Please remember to share your successes, challenges, and questions with NORC and your peers. And today's PowerPoint resources and the guide will be posted on our website and emailed to all the registrants soon. And please complete the brief evaluation that will pop up on your screen when the webinar. So again, thank you so much for joining us today. We hope you picked up something for your work, and let us know if you have any questions. Thank you all. Have a wonderful day.